This is Miss Mitzi Indigo. She just had back surgery a few weeks ago, and so she's learning how to walk again. As you can see, she has very little muscle tone left in her legs. It's kind of flabby back here, and she really needs to build those muscles up. So one thing we do with her 2 to 3 times a day, as we do her physical therapy, we exercise those muscles to help her get those muscle tone back. So what I do is I take her little legs and I just put them through their normal range of motion. Make her exercise those muscles so that eventually she'll be able to hold herself up again in the back. And we want to put through all ranges of motion and really stretch things out and make sure her joints stay nice and flexible, because they were getting pretty stiff from lack of use before we started doing her physical therapy. And we do it on both sides so that she can get the advantage of both sides being exercised. And I'll let her push against my hand. Push, 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 push. You can see she's already getting stronger. When we first started this, she couldn't even push back at all. And now she's getting stronger every day. And then we will flip to the other side. And this is her weaker leg. You can see this is the leg she was dragging. She's got a little boo-boo there that's starting to heal now. That's because she drags that leg underneath her when she walks, because she's not quite up to walking on her own yet. So we put that through its motion, we stretch it, and we try to do this maybe 3 or 4 minutes per side, several times a day, to just help those muscles build up. And we'll stretch it back and forth. We'll let her push. See, she's not pushing quite as hard. There she goes with that leg, because she's not as strong. We'll let her move those muscles. And then we'll put her in her standing position and let her start to remember where her feet are. You can see she's a little wobbly on her pins, but she's wagging her tail and she's a happy girl. And if I let go, she starts to fall a little bit, but she's getting better with that every day too. And we just make her practice putting her weight back. She's so used to dragging herself that she tends to put her weight forward and not put her weight back on those legs. So she's just got to remember how to do that, and she's got to remember where her feet are. Push, 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 push. Push, push, push. Good girl. Doing a little dog aerobics with Miss Mitzi. Gotta get her muscles strong. Okay, so here's Miss Mitzi again. Another part of her therapy to help her with her walking is that she gets therapeutic laser treatment several times a week. I try to do it at least every other day, if not daily. And what the therapeutic laser does is help reduce that inflammation that's in her back. And it's an analgesic effect, so it helps relieve any pain she might have. And will help just with her overall healing. You can see her surgical site. You can see that her back had quite a big surgery on it, so she had staples. She's a happy girl from here to here. And this is her scar. And her hair is still growing back here along her back. And so I put a little water on her because the therapeutic laser is a warm sensation and we don't want her to get too hot. So I'm going to put on my safety goggles here, and I'm going to take my laser, and then we're going to do a little laser therapy on her. And it should feel really good to her, nice and warm and soothing. And so what we do is we do a session kind of on where her original injury was, which is in the T8 region. That's a vertebrae in her back. And then we do a session lower in her back as well, just trying to get all that area to reduce its inflammation and heal up as quickly as possible, and help with any pain that she might be experiencing. So I think at this point, after surgery, her pain is pretty minimal.
Mitzi.
So like I said, I'm planning to have this picnic room.
Yes, like you said, it will come. When is it about to still a picnic? I thought you all... Ruby is one lucky woman. So
Gentle.
romantic.
So we're here with Mitzi again, and we're working on more of her physical therapy. We're going to try some hydrotherapy today and see if we can get her to use her back legs and build up those muscles. So she's here in the water in our tub, nice and warm. She's got a little life vest on for safety. We're just going to see if we can, she was swimming a little bit earlier, we're going to see if we can get her going again. There she goes! Swim, 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 swim! Swim, 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 swim! Oh, yay! Good girl! Use your back legs too! Yeah! She's using her front legs. Come on! There you go! Use your back legs! Mitzi! Push yourself up! Come on, Mama! Good girl! Mitzi! There you go, good girl! Good girl! What you doing? Come on, Miss. Get up! You see that? Oh, good girl. Good girl. Good girl.
Get the old job back? Go away. As soon as I get back in school, I'm going to work part-time for a law firm. And did you know that there are as many students in law school as there are practicing lawyers? That's familiar. I always thought we'd be friends forever. Yeah, well, the rubber got a lot shorter suddenly, didn't it? Okay, yeah, I'll call. I'll call you back.
That is cute. What's the video for?